Welcome to Community Health Matters. I'm your host, Amy Marsalis. May is Skin Cancer Detection and Prevention Month. On the show today, Dr. Lorien Sites joins us from St. Thomas Health and Nashville Skin and Cancer to talk about preventing and detecting skin cancer. Kirk Pion joins us from the UnitedHealthcare Innovation Centers of Excellence to talk about tips and resources for caregivers. And audiologist Diane Nens is here to discuss the importance of hearing health care and how HealthInnovations is providing access and affordability to help more people with hearing loss. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Did you know indoor tanning dramatically increases the chance of developing skin cancer? Indoor tanning exposes users to two types of ultraviolet rays, UVA and UVB, which damage the skin and can lead to cancer. Exposure to indoor tanning, particularly in adolescents, increases the chances of developing skin cancer over a lifetime. According to a recent study, people who use a tanning bed before age 35 increase their risk for melanoma by 75%. In addition, indoor tanning causes premature skin aging like wrinkles and age spots, changes your skin texture, and increases the risk of eye disease. For more information about the dangers of indoor tanning, visit www.skincancer.org. Dr. Sites is here today. So glad to have you here with us.
Thank you for having me.
'Tis the season. People are getting out in the sun. Weather has turned just lovely. So skin cancer, let's start with the basics. What really does skin cancer do to the body and do to the skin?
Well, Amy, that's a great question. Skin cancer, first of all, is the most common type of cancer in the world. 1 in 5 Americans actually will develop skin cancer at some point in their life. There are 3 very common types of skin cancer. The most common are basal cell carcinoma and squamous cell carcinoma. Those make up about 80% of the types of skin cancers that we see. Those are not as life-threatening and more oftentimes disfiguring because they occur on the top layer of the skin, particularly in places that are more exposed to the sun, such as your face, your scalp, your ears, your chest, and your hands. Melanoma, which is what we oftentimes think of when we talk about skin cancer, makes up more about 20% of skin cancer. Now, it is the deadly form of skin cancer, and so that's what we are typically most concerned about when it comes to skin cancer.
You know, I think that's the misconception. A lot of people think, oh, skin cancer, I'll go to my dermatologist or go to a plastic surgeon. If I've got something, they'll scrape it off, they'll cut it out.
Right.
And that is really a misnomer. What can actually happen? Not to scare people, but to let people know what can happen.
Right. Well, once again, so with our more common types of skin cancers, the basal cells and the squamous cells, those do not typically spread to lymph nodes or to organs, and that's what can be life-threatening. But what they can do is that they can grow very large on very cosmetically sensitive areas of our body, and those can invade nerves, they can form sores that don't heal, they can be quite problematic if not treated. Melanoma, on the other hand, is much more likely to spread locally to lymph nodes, and then that can lead to it spreading to other areas of the body and other organs, which can certainly be fatal.
Mm-hmm. So early detection is key with skin cancer, as in other cancers, but this is one of the most curable cancers I've read as well. So all the more incentive to check yourself or to see a dermatologist. So what are some of the early warning signs? What are we supposed to look for on our bodies?
Certainly. I think a good rule of thumb is anything that is new or changing, anything that is symptomatic, that bleeds and does not heal within about a 3 to 4 week time period. You know, the first skin cancers that I mentioned, a basal cell carcinoma, can oftentimes present as, or look almost like a pimple or kind of a pearly, shiny bump. But once again, if it doesn't resolve in 3 to 4 weeks, that's something to get investigated. A squamous cell carcinoma can oftentimes look like a dry, scaly patch of skin, maybe even a little bit of a rash. But if that doesn't respond to normal treatments, moisturizing creams, cortisone creams, and it's on a sun-exposed area, that would be something to be investigated. And then finally, melanoma, it can present on its own without occurring in a previous mole, or it can present in a mole that is changing. We oftentimes talk to patients with melanoma about the A, B, C, D, E's, and I think a lot of people are becoming more familiar with that. A stands for asymmetry. So if you see a mole that the sides don't line up, one side is different from the other, that would be something to be concerned about. B is border, meaning an irregular, jagged border on a mole. C is color. So colors, you have some color variation within that mole. D is diameter, and that is typically something greater than 6 millimeters, which is the size of a pencil eraser. Now, with that being said, there are a lot of melanomas that are smaller than that. There are a lot of normal moles that can be larger than that. And then E is probably your biggest thing when you look at moles. It's evolution or change, so something that's changing.
And it could just be like rougher, the texture can change on a mole,
Absolutely.
right?
That would be a big warning sign, a textural change or symptom change.
We're in the season of summer kicking off and everything. What is really our best protection when you're outside?
Sure. Well, in terms of developing skin cancer, the most preventable thing that you can do is sun protection. And probably the easiest way to do that is, if you're going to be out in the sun, you use sun protective measures such as sunscreen, sun protective clothing, a wide-brimmed hat, sunglasses, because the UV radiation is also harmful to our eyes, long sleeves, sun protective clothing that has UPF in it, kind of like SPF for sunscreen, but it's actually impregnated into the fabrics. And then also, seeking shade. Get under the umbrella. Avoid times out in the sun when the sun is the strongest, which is between 10 a.m. and 4 p.m.
Most of the day.
Most of the day.
A good part of the day.
If your shadow is shorter than you, then seek shade. That's a good rule of thumb.
And indoor tanning is a no-no. Tanning beds, that's not a safe way to get a tan.
There's yes, absolutely. There's truly no safe way to get a tan. Any type of tan means that you've damaged that layer of your skin and it's fighting to repair that damage. Tanning beds emit both UVA rays, which cause aging, fine lines, wrinkles, sunspots, all the things we don't like, and also UVB rays, which are what are more responsible for burning your skin and inciting that damage that can cause skin cancer. So tanning beds will emit the same amount, or in some cases even more, than the sun. So they should certainly be avoided.
And last but certainly not least, if you see something you're worried about, what do you do?
Right. So if you see some of the things like we mentioned, the first thing to do would be either to contact your primary care physician if you need a referral to see a dermatologist, or contact your dermatologist directly to be seen.
All right. So don't leave the house without a hat, SPF of 15 or greater.
Right, and actually the American Academy of Dermatology recommends an SPF of 30 or greater.
30 or greater, okay. That's something new I've learned today among several other things you've said. All right, Dr. Sites, thank you so much for taking the time to do this. A great educational segment here.
Great, well thank you, Amy, for having me.
Thank
you.
It's my pleasure.
And
have a great summer.
Thank you.
Safe summer, all right. And we will be right back after this. Did you know that an estimated 34 million people around the country provide unpaid medical care for a loved one? An astounding number of people 50 or older, and they provide about $470 billion, as you know, doctor, in unpaid care each year. What challenges do these people face beyond the monetary cost?
I'm glad you mentioned it, Amy. In fact, the other thing too I'd mention is that just in Tennessee alone, there's like 1.6 million caregivers. So even for the folks who are probably watching today, it impacts a lot of people. even on a local level. When it comes to challenges, having been through this before, I can tell you that, while you did mention money, and I think that is a very significant thing, it's about knowledge, it's about time, and it's about money. So if you think of it from a knowledge perspective, you spend so much time trying to understand, gee, what does my loved one need? Not just in terms of the medical issues, but their safety. How do you keep them living independently in their home? You spend so much time trying to think about, what do I need to do? How do I need to do it? And how to best involve your loved one in that conversation. It's a very involved process that I think takes a lot of time and energy, which kind of leads me to the second piece, which is the time piece. The amount of time that people invest in taking care of a loved one is incredible. We saw a statistic that was like about 24 hours a week that basically an average person kind of spends doing caregiving. And I think it's not only for those people who live close by that are taking care of a parent or another type of loved one, but it's also folks who just live far away, who are family members who are also trying to kind of think through these things. It takes time when you're working. It takes time when you're at home, even with your kids. And so you spend a lot of time, selfless time, trying to actually help this individual. And then I think with respect to the cost piece, it kind of plays out both from a sort of an immediate issue with respect to the fact that people pay around $5,500 a year just out of pocket in actually just providing all different types of products and services to just sort of help somebody stay living independently.
And I read that over the course of a lifetime, that could be $300,000 or something.
Yes,
to that extent.
$300,000 in terms of lost wages, in terms of Social Security and lost private pensions. So there's a long-term effect too.
So the monetary, but also obviously the emotional toll it takes on the caregiver as well. But I know that you're involved in innovations. How does technology play into this whole puzzle?
Technology is, when you think about all of the different technological advances that have just kind of gone through the course of the last few years, with the evolution of the smartphone, with the World Wide Web, the social media, all of those things are actually having a dramatic impact on caregiving. So you're seeing it in terms of the ability to provide better communication and more transparency. So you think about the fact of you can actually go out to social media, you can find a caregiving support group, you can talk to people who aren't just in your neighborhood, they're all over the country who are going through the same problems you are. You think about it from a remote monitoring, all the different types of new devices you can place in a home to actually, if you don't live near your loved one that you're taking care of, that you can actually learn more about what's going on in their home. It takes place in the fact that there's better organization around professional caregiving services. So I'm seeing a lot of companies that are just starting out trying to figure out how do I match people with the right type of caregiver so that they actually do provide good types of professional services.
So why is it so important for employers out there to help their employees? Is it the emotional support, or also you want to keep your employees healthy so they're more productive, obviously? Yeah,
it's both. And I think when it comes to an employer, they've got an additional challenge. Is they don't always know who these employees are. Because most people don't identify themselves as a caregiver, you don't really know who in your in the workforce is actually dealing with this. And so you have to think about, how do I actually reach these people? And then once I do, sort of what can I do, what can I give them to basically help to take their mind off it? Because you see it playing out in terms of what we see, what's called presenteeism, where people are at work but they're just not focused
not
at
really
work.
there.
Right, and we've estimated that it actually can cost around $33 billion in sort of lost productivity that caregiving takes across the country.
You have been through this personally, from what I understand.
Yes.
Do you mind sharing your personal experience with this?
We actually, my two sisters and I kind of encountered this a few years ago when my father was put in a nursing home and my mother was living alone. And we had the additional challenges is that the three of us lived across the country. So my mother lives in Iowa and we live elsewhere. And so we are constantly thinking about, gee, how could we be what do we need to do to kind of make sure that she is taking care of herself, that she's getting enough food to eat, that she's getting to the doctor appointments because she couldn't drive, so she was homebound. So there were lots of different issues that we were constantly faced with. So all of the things that we talked about earlier, the knowledge, the time, the money, all played into sort of helping us that we were struggling with all the time to try to figure out sort of how to best take care of her.
As we wrap this up, what would be your most important piece of advice to caregivers, if you could share one thing?
The most important thing is to take care of yourself, to find time, to plan for time, to basically do something else that takes your mind off of it, that actually helps you relax. Budget that time, whether it be exercise or going out to coffee with somebody or doing something for yourself, because you're not going to help the person that you want to help if you don't help yourself as well.
That is just a critical piece of this whole picture, it really is, and you learn that from experience.
Yes.
You know of what you speak. So, all right. Any final thoughts as we kind of close out this segment?
All I would say is that if people are looking for more information about caregiving, they can go to our website, which is uhcforcaregivers.com, or they can look at AARP for more information, or there's a
great
a
resources
here in Tennessee as well.
All right, Dr. Pion, thank you so much for your time.
Great.
Yeah.
Thank you.
Yeah, nice meeting you. Thank
nice
you.
Nice to meet you.
All right, and we'll be right back. Typically, when you think of hearing loss, at least I usually think of people over 60, 65, but Diane, that is not the case, is it?
It's not the case. We are seeing more and more hearing loss even with younger ages. So what we're finding is that it's extremely common, regardless of age. It can affect anyone. And we're seeing the increase in part due to young people using earbuds, listening to their personal listening devices at loud levels. And what they don't understand is listening to loud music today can result actually in hearing loss later in life that's permanent.
And that could start how early in life? If you're doing that as a kid, a young teenager, could that show up even in your 40s?
Absolutely, yes, because what can happen is it's cumulative. So over time, it's a slow process, can start, as you said, when they're younger, and it's invisible. They don't really see that it's happening. However, over time, it can kind of creep up on them. And what's important to know is that hearing loss is permanent. Once you have hearing loss, it's for good, unlike a broken arm that can heal over time. So using ear protection is very important, and following some of the prevention tips.
So you really need to get through to the parents, I would think, because a lot of the young kids would say, oh, whatever, I'm too young, that's not going to bother me. So the parents really need to listen to this message. Okay, so early signs you're having hearing loss. It may not just be some sudden thing. It could really creep up on you, subtle signs. Tell us about that.
Sure. So sometimes it's just a matter of asking people to repeat more often. Sometimes a person will report that speech isn't clear or it sounds muffled. Turning the volume up on the TV or radio, maybe not even hearing the doorbell, having difficulty talking on the phone. If anyone is experiencing any of those signs, I highly recommend that they talk to their doctor and they schedule a hearing test.
What other preventative tips are there? What, as far as prevention, besides taking out the earbuds and giving it a rest from the devices, what else can we do for better hearing health?
Sure. Well, one more tip that at HealthInnovations that we recommend is to follow the 60-60 rule, which means limiting the use of earbuds to no more than 60 minutes at a time at no more than 60% of the player's maximum volume. So you're really looking at watching how long you listen to the music and how loud for safe listening.
Okay. I was surprised to learn in doing some research for this segment how hearing loss is related to other health issues, such as?
Oh, it really is. I mean, we see even mental health. We see more depression in people that have untreated hearing loss. Yeah, what happens is many times as hearing loss progresses, people will withdraw from situations, and then they feel depressed or lonely, irritable, sad. So we see some of those issues. We've also seen a link with the increase of falling. So Johns Hopkins University has done a study, and they found that even with a mild hearing loss, people are 3 times more likely to fall. And then, of course, those numbers are going to increase as the hearing loss worsens. So it really, it affects many people in many different ways.
Is that tied in some way also to balance and all of that with your inner ear?
Yep, your hearing and balance are tied together. So when you have a hearing loss, it's harder to really be aware of your surroundings many times.
Interesting. Oh, I know a lot of people delay getting treatment, but there is great help out there. I think back to like even my grandfather years ago when he refused to wear his hearing aid. Of course, they were much bulkier then and they would buzz, and it's changed so much. Share the developments with us if you would.
Thank you for asking, because it's an exciting time really in the hearing aid industry. It's ever evolving and changing. First and foremost, cost. You know, historically hearing aids have been so expensive, so that's been a big barrier, but there's been many companies that are making hearing aids more affordable, and HealthInnovations is one of them. So for example, a customer can get a hearing aid for as little as $799 versus $4,000. So that's a huge comparison, a huge savings. We have that. UnitedHealthcare members. Our sister company is UnitedHealthcare.
Okay.
And we insure millions of members here in Tennessee, and they have access also to great reduced discounts. So they can purchase hearing aids for $0 out of pocket and up. So cost is one factor, and then number 2, you mentioned, what do they look like? Are they bulky? They're much more sleek and designed nicely. So if it's an issue where a customer doesn't want the hearing aid to be noticeable, you know, they are much more sleek and cosmetically appealing, so to say.
All right. If someone out there is connecting with this topic, going, okay, I think so and so in the household has a hearing loss, or maybe they're realizing it's them, where do they get more help and more information?
Sure. Well, they can visit our website, and that's at HealthInnovations.com, and that's HealthInnovations.com. We have information on there. We have articles and tips, so it's a great resource. Or they can even call our toll-free number. We have contracted providers and audiologists. They can receive a free hearing test and at least get that information. And our number is 855-523-9355. I encourage everyone to at least get a hearing test. You'd be surprised at how many people haven't had a hearing test in years, since grade school or what have you.
Any certain age that you should think about having a hearing test, or not specific? There's not a specific
Well,
time.
they say that if there's no symptoms, meaning you're not noticing anything, to start at adulthood, so I guess age 18 and up, every 10 years, and then when you hit age 50, every 3 years after that, if there's no real symptoms. But it's a real good check and balance.
All right, and one thing I want to leave people with out of this segment is hearing loss, once it's gone, it's gone. And so to prevent it is such a key. So that 60-60 rule, I'll take that with me, and I hope the rest of you do too as well. Yeah, thank you so much, Diane, for being with us today.
Thank you.
All right, and we'll be right back. Thank you for watching Community Health Matters. Learn more ways to improve your health at communityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.